We are going to talk about congenital heart diseases. Now, a heart abnormality is something that every pregnant woman is worried about. In our country alone, every year around 2 lakh babies are born and are not able to access adequate care because of congenital heart diseases. So, congenital heart diseases, the risk starts from even before pregnancy. For example, if there is a genetic abnormality in the family causing heart diseases, if the father or mother has a congenital heart disease or the sibling has a heart disease, if the mother is diabetic. Now the screening for heart diseases starts as early as 3 months. So when you get your NT scan done at the end of 3 months, so the basic screening of the heart happens right at the 3rd month itself, and major abnormalities can be detected then. At the 5th month scan, there is an even more detailed examination which looks at the heart in various planes, and this rules out as far as almost 80 to 85% of major cardiac abnormalities. Now this is important that it is done by trained fetal medicine specialists or cardiologists with special interests in fetal cardiology, because there can be very subtle signs which are indicative of a fetal cardiac abnormality. Following this, there is an option where women can get a fetal echo done. It is usually recommended for those who are at a high risk for various reasons. This is a very detailed examination of the heart of the baby, and as I said, it has to be done by well experienced trained specialists. When a cardiac abnormality or problem is detected, we have to plan for the rest of the pregnancy as well as for the care of the baby after birth. We need to see, is this problem something where the baby will be okay as long as it is in the womb, or as long as or after the baby is born. We have to see whether there is an association with genetic problems, or is it something that is not associated with genetic problems. More importantly, is this something that will have an emergency or require a procedure immediately after birth, or is this something that will be handled at a little later stage in life. And another important factor is, can this baby be delivered in a hospital which is not a specialty hospital with cardiac services, or does it have to be delivered in a multi-specialty hospital where there is facility for immediate cardiac care immediately after delivery. So it is important that these problems are identified early, it is completely understood, and there is a clear-cut plan of action, so that where the family is prepared mentally, financially and emotionally to handle this situation. Thank you.